granulomatosis, also called granulomatosis with polyangiitis, or ANCA or ANCA, associated granulomatous vasculitis. It is a vasculitis disease, which means it causes inflammation in the blood vessels. ANCA stands for anti-neutrophil cytoplasmic antibody cloning, because they are autoantibodies that attack inside of neutrophils. It is a very rare disorder affecting anywhere from 1 out of 6,400 to 1 out of 50,000 people, depending on what research you look at. I got all sorts of different numbers when I was researching this paper. No specific cause has ever been found. It is not contagious, and it does not appear to be hereditary or genetic at all. It's thought that it might be an autoimmune disease, but that has not been proven one way or the other, so I'm not really sure. Some of the symptoms include chronic cold or flu-like symptoms. So, stuffy, runny nose, sore throat, slight fever that doesn't go away, and extreme fatigue or weakness, runny nose, especially if it's bloody or discolored. And at any time, if you have green stuff coming out of your nose, it's never a good sign. And sinusitis, inflammation of the sinuses and sinus infections, night sweats, and an overall feeling of malaise, just something's wrong. You can usually tell. Some of the other things that happen with Wegener's, some patients will get a saddle nose deformity, which usually happens like right up here. The cartilage in the nose will collapse, so they'll have like a little, like a hole in their nose that looks like a saddle. Cold symptoms that do not respond to the usual course of treatment, so, okay, I've got a stuffy nose and it takes Dayquil and it doesn't do anything. The eustachian tubes in the ears can become blocked and cause chronic ear infections or even hearing loss. Also eye problems, including inflammation and even loss of vision, temporary or permanent. When diagnosing Wegener's, it's most often diagnosed by using a blood test, where they test the ANCA test. It's performed by separating out the neutrophils and staining them using a fluorescent dye that will glow under UV light, and then they examine them under a microscope to determine their character. I found two possible results. C, ANCA test, positive cytoplasmic, which means the granules are scattered around the cytoplasm of the neutrophil. Approximately 90% accurate in diagnosing serious cases of Wegener's, but only about 50% accurate for less severe cases. So, and then P, ANCA, positive perinuclear, which means the fluorescent granules are just scattered close to the nucleus, can also be indicative of WG. And some patients even will switch back and forth between testing positive for C or P. So, either one of those would be a definite warning sign for WG. Other ways that they can diagnose WG or problems also that go along with it: chest X-rays, urinalysis, and even tissue biopsies are more used to aid in the diagnosis than outright diagnose it. It doesn't appear to really affect any one group of people more than another, but it does seem to affect Caucasian people more than blacks. Approximately 95% of cases occur in Caucasians. Among Caucasian people or people of European descent, it seems to affect men more than women, but not by very much, only about 1.5 to 1. So, and it most commonly affects middle-aged people, like in their 40s or 50s is the average age. But it's been diagnosed in a child as young as a few months old, and even elderly patients. So, really, any age can get it. Some of the things it does for the body, I already mentioned the saddle nose deformity. Most commonly and most severely it affects the lungs and the kidneys. So, you know, kidney failure at the most severe end can definitely happen, and you know, and like affecting the respiratory system is definitely where the cold symptoms come into play. It can cause skin rashes, particularly in the lower extremities. It can even cause nodules in or on the lungs, infarctions of fingertips and toes, Raynaud's phenomenon, which is extreme sensitivity of fingers to cold temperatures, and can even cause gangrene. And I found at least one case, I'm sure there's been more, it caused a tumor behind a man's eye. So these are some clinical pictures I found doing my research, and this is a CAT scan showing the tumor behind this man's right eye. So as you can see, it causes the eye to bulge out, and so like this is what it's supposed to look like. So there's all sorts of good stuff back there. And then on this side we have, this is a chest x-ray that shows some nodules on a man's lungs. And this is a CAT CT scan of the same guy. Gives a little clear view of the nodules. You can see there's a big area right over here and here. So one of the main ways that it's treated is with corticosteroids, most commonly prednisone, and it can be administered intravenously or in pill form. May reduce swelling and help to retard the autoimmune response of vasculitis. Fosamax, which helps to prevent and treat bone loss, which is caused by prednisone. Folic acid is also put in there. Immunosuppressants, because they think it might be autoimmune related, so that they help to reduce the tendency of the immune system to attack itself. Some of the most common immunosuppressants are cyclosporine and azathioprine or Imuran is the brand name or whatever. For the kidneys, dialysis or even a kidney transplant in severe cases. And Imuran is used to prevent rejection of kidney transplants. Anti-cancer drugs such as Cytoxan, but the problem with Cytoxan is that it can have very severe side effects, and it can even increase risk for other cancers. Go figure, cancer drug is going to cause cancer, mostly lymphoma or bladder cancer. Antibiotics are also play a big part, especially if the patient is on immunosuppressants, because if your immune system is crap, then you can catch a cold with the drop of a hat, so you definitely want to be on antibiotics. And some other drugs that can be used are methotrexate, Bactrim or Bactrim, and Rituxan. Prognosis really depends on how quickly it's caught. If it's left untreated, most patients die within 2 years. There's no outright black and white cure for Wegener's, and many patients will suffer a relapse. Most of the relapses happen within 2 years of stopping treatment, but they can even happen while they're undergoing treatment. Go figure. Overall, though, the prognosis is very good for patients who are on a good medication regimen, especially with corticosteroids and cyclophosphamide. That's all I've got. Another quick little thing, like I said, I have a friend who has this, which is why I chose it. And she sent me a little pamphlet from the Vasculitis Foundation. They say that it affects about 1 in 20 to 30,000. Affects the upper and lower respiratory system, frequently involves the kidneys, eyes, ears, throat, skin, and other body organs. And there's other symptoms that I didn't list, like arthritic joint pain, blood in the urine, cough with or without the presence of blood, fever, inflammation of the ear with hearing problems, inflammation of the eye with vision problems, lack of energy, loss of appetite, nasal membrane ulcerations and crusting, night sweats, numbness of the limbs, pruritus, rash, rashes or skin sores, saddle nose deformity, weakness or fatigue, and weight loss. And yeah, like I said, there is no cure, but as research goes on, they find more drugs that are better at treating it. Any questions?
Some of the symptoms are indicative to the Epstein-Barr virus. Was your friend ever tested for Epstein-Barr virus?
I'm sure she was. She went to, I think, Duke or UNC. So she was in the hospital for a good amount of time, so I'm sure they tested her for all sorts of stuff.
See, before you started listing off all those diagnoses there at the end, what would make someone think that they just didn't have a cold?
Well,
what would lead you towards, okay, maybe it's not a cold, maybe it's something more?
Right. When the symptoms, they don't go away, because, you know, colds will usually last 10 to 14 days, and they can, you know, be alleviated with, you know, things like, you know, Dayquil or whatever. And so if you could, are continuing to have these symptoms and nothing seems to help them go away or make them even, you know, more manageable, that would probably be a good warning sign.
Is there a symptom that's like more common than another? Like, do they like the cold symptoms that you mentioned earlier, are those more common than like arthritis or?
I think so, because that's what I ran across most in my research was like cold symptoms that don't go away, that just stick around. And especially like when you have a runny nose that is discolored and it like starts to form like crusting around the outside of the nose, and or if you have like a lot of bloody nose